Evangelium Vitae. This is an encyclical, a letter from the Pope to the Church by Pope St. John Paul II. Now, there's already a small video on what the belief of the Church about euthanasia is from Evangelium Vitae. Please go and see that if you want to check out that little bit. This is going into more depth. So euthanasia must be distinguished from the decision to forego so-called aggressive medical treatment. So euthanasia, assisted suicide, is different from foregoing aggressive medical treatment. In other words, medical procedures which no longer correspond to the real situation of the patient, either because they are by now disproportionate to any expected results or because they impose an excessive burden on the patient and his family. Catholics are allowed to stop aggressive medical treatment or to not have it at all if the results are going to be disproportionate to any of the pain that they're going to go through in the treatment, if it's not going to be the result that is any particularly better than what they could have, or if it's only going to be marginally better for the pain that they go through. That's not fair. So Catholics can refuse treatment which is disproportionate to the expected results, and this is not euthanasia. They're not adding anything to themselves to die quicker. They are just refusing the treatment because the expected results are not going to be good enough for them to accept it as a risk. Because they have a moral obligation to care for themselves, they are allowed to refuse forms of treatment that would only secure a precarious and burdensome prolongation of life, as long as the normal care due to the sick person in similar cases is not interrupted. So we are not taking away treatment from everybody. It is their choice to refuse the treatment. And any other sort of medication that they're on is not being stopped. It's just this particular treatment that might prolong their life. We then reiterate here, to forego extraordinary or disproportionate means is not the equivalent of suicide or euthanasia. It rather expresses acceptance of the human condition in the face of death. Rejecting treatment which is disproportionate is not euthanasia. Methods of palliative care which seek to make suffering more bearable in the final stages of illness and to ensure that the patient is supported and accompanied in his or her ordeal. So palliative care is allowed and promoted in the Catholic Church. And they are allowed to take pain medication to alleviate the suffering in the final stages of their illness. There are some types of painkillers and sedatives that risk shortening life. The doctrine of double effect comes in here. They are allowed to take the painkiller if they're taking it to relieve the suffering, not if they're intending to shorten their life. So if we go down to where Pope Pius says we can relieve the pain by narcotics, even if it means a shortening of life or a decreased consciousness, so maybe putting someone into a coma. However, in such case, death is not willed or sought. All it's supposed to do is ease the pain effectively. So this is the doctrine of double effect. You take the medication to ease pain. The double effect is a shortening of life. This then is not euthanasia, because this is not the intention. This is the intention. The last thing that we have here is that you can refuse all painkillers if you want. However, you don't need to be heroic by doing this. You can accept any form of painkiller that you want in the Catholic Church, so long as it is obviously prescribed by a doctor. And it is not right to deprive the dying person of consciousness without a serious reason. So before someone is put into a coma, if possible, they need to look at the moral and family duties that they need to do, and can they reconcile themselves with God before this point.